Hello, my name is Joyce Cattengell, and this is my lovely subject, Andrew, and I'm going to be performing an abdominal assessment. Okay. So as you can see, the patient is laying down flat, comfortable, in a supine position, and I'm also standing at the right side. I'm going to go ahead and lift up his shirt so I can inspect the abdomen. Upon inspection, I'm going to be looking for things like bulging masses, any moles, any discoloration, anything maybe if it's not symmetric, if there's some abdominal tenderness or any abdominal distension. I can also see the patient's breathing patterns. So everything looks good on inspection. Now I'm going to go ahead and listen for bowel sounds. I'm going to use the diaphragm with my stethoscope, and of course I'm going to go ahead and swab it with my alcohol swab. And I'm going to start from the right lower quadrant to the right upper quadrant to the left upper quadrant to the left lower quadrant. What I'm going to be listening for are bowel sounds, and they can happen from 5 to 30 bowel sounds per minute. There are 3 types of bowel sounds. They can be normal active, hyperactive, or hypoactive. In this patient's case, he has normal active bowel sounds, and I'm going to listen for any bruits, for any of the arteries. The arteries that I'm looking for are the abdominal aorta, the renal arteries, and also the iliac. And for this, I can also use both the bell and the diaphragm. I'm going to listen for the aorta right above the umbilicus. A little bit firmer pressure. And then I'm also going to use the bell. I'm going to listen for the iliac arteries. And then further down, we could choose to whether we want to listen to the femoral arteries. Now the next steps in the abdominal exam will be palpation and percussion. First I'm going to start with percussion. Most of the abdominal sounds that we'll be hearing upon percussion would be a tympanic versus dull. Tympanic sounds, usually because the small intestines or the intestines are usually have an air flow, so it'll give a tympanic sound, kind of like a drum. I'm going to use my dominant hand and the middle finger of my dominant hand and tap the middle finger of my non-dominant hand. And I'm going to start with the right lower quadrant. So tympanic airflow. Now I'm going to be moving up. I'm going to measure from the right midclavicular all the way down, and I'm going to go ahead and percuss all the way up till I hear a dull sound, so I can check for the liver. Let me get my pen so I can mark, so I can measure and see how many centimeters the liver span is. Clavicular artery down. Right here is where it feels dull. So I'm going to go ahead and mark right here. And then I'm going to feel in between the intercostal spaces. I'm going to go ahead and percuss. Sorry, my subject here is ticklish. And so that normal liver span could be from anywhere from 4 to 7 centimeters. In this case, his liver span is within 5 centimeters from just eyeballing. Now my next exam would be palpation. And first I'm going to start with light palpation. What I'm going to be looking for is any rebound tenderness, any pain, and also seeing if I can palpate the internal organs, but that would be with the deep pressure. So I'm going to start with the right lower quadrant. I'm going to keep my hands warm. Any pain on palpation? Thank you. Now I'm going to go with the deep pressure. Now there's also something called, I guess it's called the hooking method, where I would have to hook underneath the rib so I can palpate the liver. In this patient's case, his liver is very much palpable on deep palpation. Also, the spleen is very hard to palpate, but this is how you test for an enlarged spleen. Now, go ahead and take a deep breath for me, and then palpate when they take a deep breath. And usually when you don't feel anything here underneath this rib, it means that the spleen is shifting upwards as the patient is breathing. All right, the left kidney is unable to be palpated, and also the right kidney. And that is all. Thank you. I look forward to hearing any feedback about my abdominal exam. Thank you for your time.